this particular claim from Sadiq Khan about 100,000 cases for obesity. What's going on?
It's not just one study, actually. It's two studies, both of which are amongst the worst stuff I've ever seen published in a journal. One came out in February. It said at the time that the ban had led to London households consuming 1,000 fewer calories a week than they would have done if the ban hadn't come in. And then this new study involving some of the same people just modeled what that would mean. So they did some econometric modeling and health modeling, looking at how much would obesity go down if every household in London consumed 1,000 calories a day. And they came up with their figures, which Sadiq Khan then repeated. It was nearly 100,000 fewer cases of obesity, £208 million saving to the NHS over the course of a lifetime. Khan didn't mention that bit. He implied it was per annum. But actually, Khan's summary of it was fairly accurate. It's just that the study was complete and utter nonsense, because if you look at the evidence presented in that original study that claimed there was 1,000-calorie reduction, there wasn't any difference. They compared London to the Northeast. There basically wasn't any real difference between London and Northeast. So what they did in the study was they did some more public health modelling, and they said, well, let's kind of speculate on what would have happened to chocolate consumption and pudding consumption had there not been a ban. And in their counterfactual model, it turned out that had there not been a ban, there would have been a huge rise in the consumption of all these things. An off-the-scale rise has never been seen before, but that didn't happen because the ban came in. So the difference between their ridiculous counterfactual and what actually happened, which wasn't really anything at all, the difference between those two data points is their 95,000 people fewer obese in London statistic.
Well, you mentioned that counterfactual, and we do have a graph here from this study that we can show on the screen, which is the difference between the North East and London. Now, in this graph, the orange line is the North East. You can see the North East consumes more chocolate and confectionery. The blue line is London, and that black line in the middle is the date at which this policy comes in. Now, the dotted blue line here is the imaginary world where the policy didn't come in. And as Chris Snowdon was explaining there, the modelers imagine that in the world in which there is no junk food ad ban on transport for London, suddenly the amount of chocolate and confectionery consumed in London would have soared to the level it is in the North East. And what actually happened is it stayed relatively the same level below it is in the North East. I mean, how do they get away with this stuff? I mean, it seems completely fairy tale.
It is, really, yeah. But you see more and more of this public health modelling. Public health modelling is used to get policies introduced in the first place. We saw that with minimum pricing in Scotland. But it's increasingly been used to evaluate policies after the fact. I think most people reading these headlines would assume that at least they've kind of counted up how many obese people there are in London or made some kind of estimate. Actually, we have no idea how many people are obese in England in 2020 yet, because those figures haven't been released. I don't think they even get released on a regional basis anyway. What we do have, however, are the childhood obesity statistics. And what we can see looking at those is that 2021, you saw a big rise in childhood obesity across the country, almost certainly due to lockdowns, kids not exercising, not going to school. But the biggest rise by far was in London. London now has the highest rate of childhood obesity in the country. The rise in obesity or childhood obesity in London was twice as fast as in the rest of England. So on the face of it, there is very, very little evidence indeed to suggest that 100,000 obesity cases have been prevented.
Well, what an extraordinary situation. I do hope that this travels far and wide, because the amount of junk science that we're starting to see proliferate the media and indeed our politics, it's really quite concerning.